tax workshop, which is 10 to 1:30 tomorrow. But do RSVP if you're interested in that. I'm Richard Kravitz. I'm the director of UC Center Sacramento, and it's a real pleasure today to welcome Professor David Cleveland. He's a research professor at UC Santa Barbara. He's trained in anthropology. Actually, that's the field in which he earned his PhD. Spent some time in the field in Mexico and other countries, and also served as a professor at the University of Arizona for a period of time before coming to UC Santa Barbara around the year 2000, and has been there since. His work obviously cross-cuts lots of different fields and really kind of addresses a question that I think is important to many of us, which is when confronted with the enormity of some of the world's problems, what can we as individuals do, and what can policy do to encourage us as individuals to do it? And of course, eating, as we all know, and as Professor Cleveland will emphasize, is something we do 3 times a day. And this is a way in which we can perhaps truly influence not only our own health, but the health of our planet. So it is a great pleasure once again to introduce Dr. David Cleveland, speaking on why diet change is critical for successful climate, health, and social policy.
Thank you, Richard, and thank you, UC Center, for inviting me to come and talk about diet and climate. When I came over here earlier this morning to make sure I knew where this place was, the person at the security desk asked me why I wanted to know, and I said, well, I'm giving a talk at noon. He said, what's it about? I said, diet and climate. He said, hopefully, I can't use that word, but I've never heard those 2 things used together before. How many of you have heard those 2 topics brought up in the same context before? Good. Most of you are on board with this. So, what I'll have to say will go a little bit beyond maybe what you've heard about these topics. And I want to start with a question of what do we want from our food system? What do most people want from their food system? And I think most people, if they think about it, like delicious, nutritious food that makes us healthy. It's also affordable. We want environment and climate-friendly food, and we want just and ethical food that supports our communities. But all of these things are threatened by our current diets. So this is the argument I'll be making in the next 35 minutes or so. First of all, the problem. Our food system uses lots of resources and generates lots of pollution, and that's led to a food, climate, health equity problem, which I'll explain. So then I asked the question about solutions. Is diet change needed to solve these problems? And I hope you'll agree with me after I present the data that yes, it is. So that brings up the big question, the policy question. What can we do to drive policies and actions that will actually change diet to the extent needed to really make significant impact on climate change and our epidemic of diseases which our diet's causing? Okay, begin with the food, climate, health equity problem. Our diets are killing us. There's been a dramatic shift in the last century in most industrial countries, including the United States, from us dying mostly from infectious diseases. We've had all these antibiotic and clean water revolutions, and so now we're dying. 2/3 of our deaths are attributable to what epidemiologists call non-communicable diseases, these diseases that are non-infectious, diseases like cancer, heart disease, diabetes, and the culprits in our diets are mainly animal products, especially red and processed meat, dairy, added sugar, soda-sweetened beverages, saturated fats, and refined carbohydrates. These are the culprits. Our diets are also a major contributor to climate change and resource depletion, pollution in general. Most estimates are that globally and within this country, our food system accounts for about 25% of our anthropogenic greenhouse gas emissions. Mostly it's from animal foods. And at the same time, it's a positive feedback loop because our food system is driving climate change. Our climate change is making it more difficult to grow food due to, like here in California, the drought, in many parts of the world, either too much water, flooding, too little water, and higher temperatures. Animal foods are the most greenhouse gas intensive. This graph shows CO2 equivalents per gram of protein, and you can see that on the left side of the graph, the plant foods are much lower per unit of protein than the animal foods. On the right side of the graph, especially, again, red meat. The same pattern holds true when you look at greenhouse gas emissions per kilocalorie or per serving. And our diets are also driving inequality and suffering. Unfortunately, while it's easy to find diets or foods that are both good for our health and good for the climate, a lot of our foods in our food system today are good for profit and bad for our health and bad for the climate. And people of color in low-income communities are targeted by the food industry specifically because they're more vulnerable to these foods. And these same communities bear most of the costs. The prevalence rate for these diseases is higher in these communities. And these communities are also the ones nationally and internationally that lack the resources to provide their own adequate, healthy food. Okay, so that's pretty depressing, huh? What are we going to do about it? How are we going to solve this problem? I like to go back. I like to think about problems in kind of a deep history format. And I think the Neolithic is where we have to begin looking. We could look further back. Let's start the Neolithic. About 12,000, 13,000 years ago, human beings shifted from mostly foraging, gathering and hunting, to growing our own food. And this response to increasing demand through population growth and so on established a supply-side strategy. And if we look at the other revolutions that have come on since the Neolithic, the industrial and scientific revolution, fertilizers, machinery, oil, the Green Revolution beginning after the Second World War, the globalization revolution, especially in the last 20 years or so, and the biotech revolution since the early 90s, all of these are supply-side responses to increasing demand for food, both in terms of numbers of people and per capita consumption. The problem is that these kind of supply-side strategies have prioritized production over human and environmental health and have led to what many people are now, I'm sure you've heard, we're in the Anthropocene epoch, and a period in which the geology of our planet, including our atmosphere, is being markedly affected by human activities, and it's led to the breaching of planetary boundaries, sustainable boundaries. For example, if you look at these what people call hockey stick type curves here, population as a proxy for demand. This would also go for per capita consumption of things like food, and the impact of our demand on the environment through supplying that demand. The rate of change, the rate of impact, the rate of demand is growing super exponentially in this recent period, and it's not sustainable. It's just not possible to continue to meet the problem of increasing demand by continuing to increasing supply. So, voila, diet change comes to the rescue. We need demand-side solutions. We need not to always be thinking. There was just a supplement in the Sacramento Bee this morning about hunger, and the dominant message in that thing, there were many, but I think the dominant message was, how are we going to get enough food to feed people? It wasn't about how are we going to decrease the demand for high-resource foods. how are we going to make things more efficient? Was how can we produce more food? And this is also the theme of the Food and Agriculture Organization in Rome and of our own USDA. It's how can we get more food out, genetically engineered crops or more efficient irrigation. How can we produce more food? But it ignores the fact that there are limits to this increase. So diet change is a demand-side solution. It's focused on decreasing demand for resources rather than continuing to try to increase supply. It will therefore reduce resource use. It will reduce water, oil, soil, all these other things. And it will allow, therefore, for the redistribution of resources so that people who don't have enough resources to produce adequate food can then have enough resources. That's the social justice aspect of it. And given those curves, given those super exponentially curving lines of impact, we really need to do something very rapidly. I'm sure you've heard, even in Paris, even all those politicians agreed that maybe even 2 degrees centigrade wasn't an efficient limit to avoid real catastrophe. Maybe we need to push it down to 1.5 degrees centigrade increase in average surface temperature. So diet change is also important because it can be done pretty rapidly. We can change our diets. It's not like decarbonizing the electrical grid or switching our whole fleets to more climate-friendly fuels or energy sources. It can be done fairly rapidly, and it depends to a large extent on each of us in the room. Diet change is needed to reverse the pandemic of non-communicable diseases and the soaring health care costs which those diseases incur on society. This is the healthy food plate from the Harvard Chan School of Public Health. Diet change is also needed to fight global climate change. This is a graph from an article by a group out of Cambridge published a couple years ago, and I think it really, to me, it really epitomizes the situation in terms of diet and climate change and the necessity for diet change. If you look at the dashed line, the dashed current greenhouse gas emissions from food system, you can see it's about 12 gigatons of CO2 per year from the food, just from the food system today. If you look at the red line, that is the limit that has been estimated that we can emit by 2050 if we want to stay within that 2-degree target, that 2-degree limit. This is where our food system, if we don't change anything, if we just keep our food system going the way the FAO is talking, the way many other people, with minor tweaks, if we just keep increasing supply, keep increasing animal food consumption, as incomes increase around the world, the consumption of high resource foods like animal foods, processed foods, and so on also increases. If that continues, the food system alone will almost gobble up all of the allowable greenhouse gas emissions allowable to stay below that 2-degree limit. What does that mean? How much does that leave all the other sources, transportation, energy? Almost nothing. How likely is it that those sources are going to reduce their emissions to zero? Not too likely. So what does that mean? If the food system increases yield to the theoretical field maximum, and if we reduce our food waste by 50%, food waste is a big contributor to food system greenhouse gas emissions. If we do that, the food system will still account for half of that allowable limit, which means that the other sectors would have to proportionally reduce their emissions more than the food sector, and that's not too likely either. It's only if we add in diet change that the emissions from the food system by 2050 gets down to about 25% of the allowable total and gives all the other sectors of the economy the chance to reduce their emissions by the same proportion, by the same rate as the food system. Diet change can also reduce our healthcare cost greenhouse gas emissions. This is a research project that we published earlier this year. It's not surprising that improving our health could reduce greenhouse gas emissions, just the fact that, for example, in the United States, our healthcare expenses are almost 20% of our total gross domestic product. 20%. $3 trillion plus just for healthcare in this country. And it's hard to get really firm estimates, but I've seen healthcare professionals, epidemiologists, estimate that probably at least 60% of that healthcare is due to non-communicable diseases, to which diet is a major contributor. Do you have any idea, Richard, of what that estimate is? Yeah, it's big. It's very big. So what we did is we looked at the standard American diet. I keep wanting to use the laser pointer, but I don't have the screen so I'm not using it. I could go around and point at each one, but I wouldn't finish in time. Anyway, so we modified the standard American diet and created what we called healthy alternative diets, and as long as it's not mine, I don't mind. It's really embarrassing when the speaker's phone goes off. Anyway, so we reduced the relative risk of 3 non-communicable diseases, and then looked at the healthcare cost reductions from those, and then how that healthcare would contribute to greenhouse gas emissions reductions. We also looked at how those diet changes would affect greenhouse gas emissions of the food system, and this is what we found. We only changed the foods for which there were pretty much broad agreement nationally and internationally on what would be a healthier diet, and we only reduced those foods for which there's very strong epidemiological or clinical data relating those foods to these diseases. And so we reduced red and processed meat, and I'm showing you here we had 3 diets, so I'm just showing you the third diet, which was changed the most. So in that third diet, we eliminated all red and processed meat, we reduced refined grains by 2/3, and we increased fruits and vegetables, beans and whole grains, and added in enough beans and peas to make up for the protein reduction in reducing the meat component. And this is what we found. That third diet would reduce the relative risk of these 3 diseases, coronary heart disease, type 2 diabetes, and colorectal cancer, between 29 and 45%, which would result in a $93 billion decrease in healthcare costs in the United States. And remember, this is only half the diet. We only changed about half the foods in terms of the calories in the diet. We didn't touch dairy, fish, poultry, sugar-sweetened beverages, all these other things that also there is some evidence that they can contribute, but the evidence isn't strong enough. So we wanted to just be as conservative as possible. We also found that these reductions contributed to reduction in greenhouse gas emissions that would amount to 3% of the U.S. climate, I should say the former U.S. Climate Action Plan, because there's not much action anymore at the national level, unfortunately. But it would also exceed the much more modest California AB 32 targets for 2020. We also looked at the targets for 2050 with 80% reduction, but we didn't, I don't show these here, would be less, obviously. We also looked at the, we also looked a little bit at what the effect would be if we included all the other relationships for which there weren't the highest quality of data to support. And we found that if you included these other foods for which there were some data supporting these relationships, that the contribution of diet change to greenhouse gas mitigation through the healthcare system would increase quite a bit. And these data are being generated now. There's an explosion in research on the climate effects of diet. And so I think as these data come in, we'll be able to estimate a much larger proportion, a much larger benefit to diet change. And we didn't include indirect healthcare costs. For example, the loss of productivity. There's a huge loss of productivity because of things like diabetes, cancer, other metabolic diseases, and when efficiency is, when workplace efficiency is reduced, the greenhouse gas emissions per unit of production increase. So we didn't include all those. So pretty conservative estimate. Diet change is also needed for social justice. And I want to show you here the relationship between well-being on the y-axis, and I used the United Nations Happiness Index, which is a composite index which includes things like subjective measures of well-being. It includes happiness. It includes health measures like infant mortality. It includes life expectancy. So it's an index of how well off people are, how they feel, too. On the x-axis, we're looking at per capita gross domestic product, kilocalories of food, and greenhouse gas emissions. In other words, indicators of people's impact. When you look at countries like Haiti or populations like the Haitian population within countries like the United States or other countries, you can see that Haitians aren't very happy, and for good reasons. They have very low gross domestic product per capita, low incomes. Their caloric consumption is below recommended 2,000 kilocalories a day minimum. Their greenhouse gas emissions, therefore, are also very low. Compare that to a country like Costa Rica, where has much more wealth per person, income per person, has plenty of kilocalories per person, has greenhouse gas emissions, of course, that are about 3 times as much because they're consuming more. But look at their happiness index. They're much happier. In fact, they rank number 12 out of about 150 countries in the UN index in terms of their well-being. Now let's come home. Here's the United States. We are, according to this index, which of course we're not as happy as the people in Costa Rica, but we consume a lot more and we generate a lot more greenhouse gas emissions, about 7 times the emissions per person as in Costa Rica, but we're not any better off. We're not happier. What does this mean? This means that we could, through diet change, by reducing the resource and pollution intensity of our diets, we could free up that pollution space and those resources for those countries like Haiti, for those populations within countries. We could free up those resources so they then could bring themselves up to countries, the level of countries like Costa Rica, and have a much better life. And there would still be a net reduction in greenhouse gas emissions. This is a project we're working on right now to quantify this a little better. And people who are high consuming would maybe even be happier, be better off, and they would have lower levels of these diseases. So what are the obstacles? Unfortunately, in our current system, a lot of the foods that are bad for our climate and bad for our health are also good for corporate profit. And oftentimes, it's those, even though there are many wonderful public health programs, even there's federal programs that are still surviving. I get the USDA Food and Nutrition emails every couple times a week, and there's still great stuff happening. It hasn't been totally eliminated yet. In spite of that, the dominant force in our food system is food for profit. For example, on my campus at UC Santa Barbara, we have lots of great programs. Part of the Global Food Initiative, or the Global Food Initiative, the UC-wide Global Food Initiative. We have a food pantry. We have educational programs for students to help them learn how to cook, how to purchase food. Great programs, but we also make a lot of money off from food that makes our students sick. We have, these are pictures from our campus. So we have Subway, we have Panda Express, we have a pouring rights contract with PepsiCo. So PepsiCo has paid our university money so that they can then have exclusive access to our students to sell them Pepsi. UCLA has a $15 million contract with Coca-Cola. This is I find this really bizarre, and I think that's one of the things that's motivating me in my research right now, is to try to move us toward a conversation where we can look at these things in the same field of vision and say, gosh, that doesn't make sense that we're saying people have to be healthier. We have abundant scientific information for how that needs to happen, and yet our food system is dominated by bad food. Can't we do something about this as a society? Can't we create policies that will begin to rectify the situation? How do we do that? Well, I want to give you a few examples of things that are happening, things that are possible with policies. As you probably know, there's been a rise in the number of cities in this country that are passing soda taxes. Mexico has a soda tax that seems to be going well in terms of reducing these diseases that I mentioned. Measure D passed in Berkeley, but the beverage industry spent $2.4 million in Berkeley to try to defeat that soda tax. And they spent something like $6 or $7 million to defeat the San Francisco soda tax, which they did because it required 2/3 majority. But the grassroots campaign succeeded. People are getting fed up with being pushed around by the food system, and the results so far from Berkeley have been positive in that compared with the controls, without soda tax, their soda consumption has decreased, and maybe even more importantly, the average water consumption has increased. Reduce the availability of bad food. One way to do this, UC San Francisco 2 years ago introduced part of their healthy beverage initiative. UC San Francisco outlawed the sale of soda on their campus. And they didn't get a lot of bad feedback. In fact, they did a survey after the soda ban had been in effect for a year, and 80% of people on campus liked it, even those people who formerly had been consuming a lot of soda, because they said, we know we shouldn't have been consuming that much, so this really helped us. In other words, the environment was changed, so people's food choices, the default food choice moved, the needle moved from the default being really from soda to being other things that are more healthy. So this is part of reducing the availability of bad food. We also need to increase the availability of good food. The Oakland Unified School District has shifted their animal products in their food, and you can see, ironically, the beef consumption actually increased a little bit, but these other animal foods decreased enough that they saved a lot of money, they saved a lot of water, and they reduced their climate footprint by 14%. This is, again, something that's happening in a lot of school districts here, especially in the industrial world. We can also increase information. Every 5 years, the U.S. government revises the dietary guidelines for Americans, and there is a dietary guidelines advisory committee that collects and analyzes information. And in 2015, the advisory committee recommended for the first time that the dietary guidelines include a link between health effects and environmental effects of food. What do you think happened? Well, one of their recommendations was to reduce the consumption of red meat. The American, beef associations, meat associations, but strong, so the Sugar Association, for other reasons, put strong pressure on the government, and Obama's Secretary of Health and Human Services and Agriculture went in front of the Congressional Committee and said, we're not going there. Don't worry, we won't go there. Tremendous pressure from this food industry. And one of the great things that Obama's administration did was start to begin to revise our labels, our nutrition labels on our food, so that they make more sense to people in their daily lives. And one of those things is putting the amount of added sugar on the labels. Not just total sugar, but added sugar. And this is an example of one of the proposed labels here. the current administration in Washington, it's not likely that they are going to. In fact, they've shelved this whole thing and say, oh, maybe in the future. So again, pushback from the industry. But in addition to information and changing environments and so on, we often need a change in values to change our diets. And I really like the story that Richard Ray Perez tells. He is a filmmaker who did a film that you may have seen, a really great film called Cesar's Last Fast. And he tells the story of being a kid in a Head Start program in Los Angeles and sitting there at the lunch table, and his teacher is carefully plucking out all the, that syrupy kind of fruit cocktail you might have had, plucking out all the grapes, not eating. So Perez says, why are you doing that? And he said, well, he explained to them the UFW had a boycott of grapes because they were pushing for better worker conditions in the field, justice for those people in the field, better wages and so on. And all of a sudden, those little sweet grapes that Perez had been eating and just thinking, God, I really like this, really tastes good. All of a sudden, those grapes exploded out into the world. And when he looked at that grape, it wasn't just a little grape that was going to taste good. It was a grape that had connections to all those workers in the field. And the grape began to embody the idea of fairness and justice. So we stopped eating. And I think this is one thing that we all need to do, because when you look at the research that's been done on why people select food, what do you think it is? It's cost, it's taste, it's convenience, it's habit. That's why we choose most of our food. We've got to get away from that because our food has such a big impact in so many ways. Here's an example from the Bay Area. The UC San Francisco and the Youth Speaks organization created a project called the Bigger Picture Project. And they're engaging young middle school and high school students in the campaign. Their focus is to prevent type 2 diabetes, which is devastating, especially communities of color. Low-income communities are being devastated by diabetes and other metabolic diseases caused in very strong evidence that they're directly linked to the amount of added sugar in our diets. And so they're training these kids. Youth Speaks trains kids to do these rap presentations. I do an imitation, but I totally wouldn't want to see it. But if you go online and look at their website, they have tons of these great videos by these young kids explaining how the food system is pushing us. It's killing us. They do this thing where they bring this giant inflatable soda can. You can probably guess what brand it's supposed to be, only instead of that brand name, they have diabetes written on the side of it, and they engage the students in these campuses so that the students are aware of what's being done to them. And there's research by a couple of psychologists that's ongoing. They just published a paper this year with the results so far, in which they've been working with kids in Austin and New York City, and they found that when they have a control group where they give information, they tell these kids, look, the food you're eating, that ain't good for you. You're going to get diabetes before you're 15. This is terrible. The kids say, oh, yeah, well. They get it, but they don't change their food choices. The treatment group, they did what they call an expose, and they told these kids, you know what? This food that you're eating is going to kill you, and you know who's pushing it? These companies are tricking you into buying this food. They're advertising their food placement. You know what? Those kids changed their food choices because that information activated their sense of autonomy and fairness, social justice. So I think values are also really important. So I hope that you might begin to agree that we need policies and actions to reclaim our food system for our own health, for the health of the planet, and for the health of everybody, for communities around the world. We need to change the way we eat. Changing our diets is key. Thank you. Okay, Q&A. Any questions? Yes.